There's a connection with the University of Sydney Medical School, a student exchange and collaborative research projects. And of course, there's the Weill Cornell Medical College in Qatar. I hope you'll join me in recognizing a recently appointed Dean of Weill Cornell Medical College in Qatar, Javed Sheikh, who's here. Congratulations, Javed. See, all the big shots come to my lectures, and they come for one of two reasons: because they learn so much, or because they're afraid that somehow I'm mentally taking attendance. And we got all kind. We got neuroscientists here. We got famous vascular biologists. We got dermatology people. It's unbelievable. And I have taken attendance, and it's good, Gronstein, that you showed up. That's all I can say. This is the first university, the one you are in, to grant an MD degree overseas. Still the only one. And I had the great honor of officiating twice, and we'll be doing it a third time in about 5 months. And it's another very successful exercise in capacity building. Initially, capacity building in the sense of medical education in a part of the world that has population growth and needs more medical education. But now, because of Javed's work and David Hadjar's work and others, and there's David Hadjar, he's right there. There's like a light shining behind you like there normally is. And I don't know how you arrange that always to be under a spotlight, but yeah. You don't have to say anything, you just have to laugh, and I'll do the jokes, okay? But because of the good work that they have done, there's now a formal research infrastructure in Qatar, and then a new hospital, the Sidra Hospital, that's being developed. So it will have the complete tripartite mission of any academic health center in North America. And it's a very, very important exercise in capacity building as well. Liz Francis reminded me when she saw the first draft of this PowerPoint to put a slide in about the global health curriculum that's sponsoring this, and to say something, to have words, not just verbalization, which I was going to have about the emergency medicine program, which just goes to show you that I'm the president of a big Ivy League university. I'm sort of a big hotshot. And she's a fellow, and I send her the thing so that she should do the work of putting it on the computer. But no, she critiques it, see? And she does a good job of critiquing it. It makes it better. So that keeps me humble, and it's good. And it may extend your fellowship. It may take you longer to get the credit for the fellowship because of your attitude about this. But I do want to thank Liz for leading me carefully through the process of getting ready for this talk. And I do congratulate you in all seriousness and candor on the global health curriculum, which is a national leading curriculum, and also on the emergency medicine program, and hope that you'll have a chance to invite me back to learn more about that in the future. I also want to mention, and you may or may not be aware of this, that the Gates Foundation, in addition to that enormous project on stem rust, on the fungal disease of wheat, also has this Grand Challenge Exploration Grants program for innovative global health research, and no fewer than 3 of the faculty here have gotten those, Dr. Moscona, Dr. Nathan, and Dr. Ree, and you probably heard about this when they first came out. It's very, very impressive, and once again shows the broad sweep of the work going on here related to global health, and reminds us the importance in global health of not only the service delivery and the systems development, the healthcare systems development, but education and discovery, always education and discovery. There are some cross-campus initiatives or trans-university initiatives, and one of them is the Global Health Program per se, and the mission, of course, is to engage new researchers in the field of global health and establish new collaborations and develop curriculum in both course-based and experiential learning, as you have with the global health curriculum here. As in so many leadership things related to global health, Warren Johnson, again, is in a leadership position working with the nutritional sciences professor in Ithaca, Rebecca Stoltzfus, and they immediately got NIH support. If you're a federal taxpayer, and I have it on good authority that many of you are federal taxpayers, a certain proportion of your taxes basically go to Warren Johnson, who's been pulling down NIH support for a very long time. One of these days, the NIH is going to call Warren Johnson and say, enough is enough, but not soon, I hope. And This is another example of that, getting an NIH grant to get this program started between the two campuses. Graduate programs, there is, as I mentioned, undergraduate minor, a lecture series, and it was developed by these different colleges. Weill Cornell, the College of Human Ecology, Arts and Sciences, Veterinary Medicine, and Agriculture and Life Sciences, reminding you and bragging a little tiny bit that both veterinary medicine and ag and life sciences are the #1 ranked schools in their categories in the United States. So it's a very, very powerful combination of strong colleagues in those areas in Ithaca and the huge strength and longevity that you have here, as I've tried to bring out today. The goal, of course, is to develop the vision, I guess you'd say, in modern lingo, is to develop students who have knowledge and skills in some of these areas and can make lifelong contributions in global health. Once again, the building of capacity to deal with problems is more important in the long run than even dealing with current problems, because problems evolve, problems get complicated, problems get added to each other, but it's the capacity to solve problems locally and to decide what problems should be solved that I think should be the main thrust. I want to talk for a couple of minutes about nutrition, which I believe is a focal point for global health initiatives, and urge you to think more and more about nutrition, as I do my colleagues in Ithaca, as you go forward in discovery and capacity building in global health. As you know, both undernutrition and obesity are major global health problems, and that point reminds me to remind you how in the developing world we tend to think about the diseases of poverty as the main burden that the countries bear, the people bear, and that health givers bear. We tend to think rightly about communicable diseases. We tend to think rightly about lack of sanitation and water quality, which of course is linked to communicable diseases. We should think about maternal and child health and the many burdens borne by women everywhere, but especially in these cultures. But we also need to remember that in these settings, as economic development takes hold, the diseases of poverty are being joined by the diseases of excess, including chronic diseases, chronic non-communicable diseases, obesity and diabetes and cardiovascular disease and stroke and myocardial infarction and so on, and that the burden, therefore, on the healthcare workers in those countries is enormous and variegated to the point that it's breathtaking, that they're still dealing with the diseases of poverty and having to also deal with the diseases of excess, chronic, non-communicable diseases. And nutrition, unfortunately, is a pivot point for both ends of that spectrum. This is adapted from Margarella in the Nutrition Reviews in 1996, and I hope you have a chance to take a peek at that volume. It's a very interesting article, and it makes the point of the linkage between improved nutrition and economic growth. It talks about cognitive and physical development, as you see, leading to increased human capital. That's sort of an unfortunate term that people use, but what I call capacity building, which has to do with health and education and longevity and eventually productivity, and therefore poverty reduction, and then economic growth, which can lead to improved nutrition and a positive feedback loop. And also, in addition to the direct improvement that I've just mentioned, through the effects of nutrition on the individual, there's also a chance to improve food systems and markets and health systems and improve the economy of the country as well as the economy of an individual family or a village. It's a focal point for global health initiatives, I believe, because of the role of nutrition and genes and gene-nutrient interactions in infectious diseases. I know that many of you are aware of the focus on iron metabolism and infection susceptibility in HIV, AIDS, and tuberculosis, and the need to define best practices for anemia treatment and prophylaxis.